If we had a system where the health insurers were incentivized properly to make sure that people stay healthy rather than get into the hospital, we'd have a lot more attention to that kind of well-being and behavior change. That's coming now, for sure. Public health is a discipline which now goes back 150 years or so, has tended to focus not just on population, which is the public part of the health, but on prevention, on making sure that there's safe water and sewerage in cities, that epidemics are halted by quarantine. These are the old methods that proved their effectiveness a long time ago. So the field of public health has been about prevention. But what's also clear is that as our lives changed, as we became much more urban, as food became absolutely plentiful and more than plentiful for a very large part of society, as a lot of industrial processing of what we eat and how we eat came, and I would say as the advertising age came in and learned how to press every one of our hot buttons and do so with magnificent, exquisite precision to get us to buy products and even to become addicted to things that really are not for our long-term well-being. The behavioral side of health, what keeps us balanced, healthy in our lifestyles, that's really taken a remarkable assault, obviously. And so whether it's a diet or substance abuse, tobacco for a long time, which was a hugely manufactured product and one of the great mass killers of the world, all of this has been a major factor, not traditionally seen, certainly not within the formal medical sector, really not even within the health sector, but it has been a concern of public health. Now, the way that American medicine has been reimbursed, it's been for treating patients. It has not been giving the incentives, by and large, to help people to stay healthy. Who gets paid for that? If we had a system where the health insurers were incentivized properly to make sure that people stay healthy rather than get into the hospital, we'd have a lot more attention to that kind of well-being and behavior change. That's coming now, for sure. And especially in parts of the US population that are more aware, typically higher educated population, there's been huge change of lifestyle, of course, in tobacco use, in moderation of alcohol, in much healthier diets. But in parts of the US population with poor education, or where these more healthful behaviors, say in diet, are simply more expensive per calorie, it's harder for poor people or less educated people to stay healthy and to know what healthy behaviors are. So because American society is so unequal, and since there's so little direction to public health per se, it's not really part of our focus, I think we fall far behind what we could be doing and far behind what more health-seeking societies, I think of Scandinavia as examples, have already achieved.